Hey James, do you know what a joint wrinkle is?
Joint wrinkle? No.
Tune in to the 50 Shades of Pain show to find out. Welcome to the 50 Shades of Pain show, where we empower our community by giving you information about pain, both physical and emotional, to optimize your health. Hi, I'm Dr. Donish, Medical Director for Wellward Medical here in Lexington, Kentucky. I'm here with my co-host, Dr. James Escaloni, our movement specialist and physical therapist.
Extraordinaire.
Extraordinaire, couldn't forget that. So today we're talking about joint wrinkles.
Oh, yeah.
That was my bad impression of the 1990s, the record skipping. There you go.
There you go. I was longer a DJ than him.
So joint wrinkles is essentially my term for joint arthritis, because we all have this fixation on cartilage being the thing that's visible that's causing pain. Like if people talk about bone on bone pain, you go and get on a flight and you see that throwaway periodical that has the picture of the knee on one side, and on the other side it's like this compressed joint, and we think that's what hurts in arthritis, and it does, but it's a late stage problem. It's not what most people experience for the majority of their exposure to arthritis. What arthritis is it is indeed joint erosion, but the question is why does one joint erode when the other one doesn't? And you're using both of those knees, or you're using both shoulders. So what do you think makes the difference?
Oh, I think that there has to be something that people are not looking at for it to be the key.
And the key there is joint wrinkles.
Yeah.
So as we age, it's visible that we all age on our skin, where our skin gets a little bit loose and saggy and we see wrinkles forming. Why wouldn't the same thing be happening on the inside? And indeed it does, but it's just hard to see those things on X-rays and MRIs. So what we actually do look at is how far advanced the erosion has taken place. But a joint that's moving the way it was designed to move doesn't have a reason to erode. It rolls. Like if you look at your knee, you've got two bones sticking on top of each other, and when your muscles flex to bend that knee, it's like a rolling hinge joint. So it doesn't really erode unless it's not held in place. And now every time your muscles fire, things have to slide to take up the slack, and then it hinges on a smaller axis. So because of that smaller axis and that sliding, that's why you get erosion and the term arthritis. But really the precursor to all of that is a joint that has lost its stability and it's wobbly. That comes from joint wrinkles.
With joint wrinkles, what exactly is that wrinkle?
So your joints are held together with ligaments, soft connective tissue. These are things that have a tension line along the path of that ligament, and it's meant to hold a certain tension. Now, if your body changed how it moves, like you have an injury somewhere else, or you have an old injury that's scarred over with fibrous tissue, that fibrous tissue is not as strong as healthy ligamentous tissue, which is oriented fibers in one plane. It's like a bundle of spaghetti. It's really hard to break that bundle, but it's easier to do it one by one, or if you've got a whole bunch of spaghetti going in different directions, it's easier to break that bundle. And it's because the linearity or the straightness of those fibers give it its strength. If you've had an old injury, that scar is no longer linearly aligned. It's got a scar tissue in it. And while that scar might be stable for most of your life, at some point it starts to break down and it causes some looseness within that ligament, what I call joint wrinkles.
Okay. Now, with this joint wrinkle, is this something that is often talked about in medicine?
Yeah, we don't really go for those funny terms. We have these long, elegant names for different things. So joint wrinkles is kind of my thing. But having seen enough ultrasound images of knees and shoulders and ankles, we've indicated or documented that these ligaments lose their integrity, and over time they become looser and wobbly and can cause that joint to become loose. Keep in mind, ultrasound is a pretty new way of looking at the body. It's something that's only been around for about 20, 30 years in mainstream medicine. Prior to that, it was mostly research. So the number of clinicians who are used to looking at joints in varying shapes and sizes, there aren't that many who use it on a regular basis. But the fact that we look at everybody through an ultrasound so we can see that soft tissue, we've seen enough repetition to know that these ligaments start to break down, and they themselves cause pain, but they also lend the joint to looseness that causes arthritis.
I definitely appreciate with what you just said, because when looking at somebody's ultrasound, it's not just they're sitting there. We're actually getting to see what happens if they move their shoulder up and down, they move their knee left and right. And you can see how, oh, this looks okay if you're just laying there. But once we start moving it, that ligament right there, it's a little bit wonky.
Yeah, absolutely.
So that's where that laxity would cause some sort of joint compression.
Right. And so those things don't really show up as major problems. It's just like a little bit of an ache every time you take a walk. And then once your joint warms up and it kind of starts to move, that pain can go away. But that may be the small canary in the cave that's signaling a progression that is going to lend itself towards an arthritic joint 5, 10, 20 years down the road.
I especially appreciate seeing people with shoulder injuries, old dislocations, and they think they're fine. And then all of a sudden they start to get more and more rotator cuff tears because the rotator cuff has to work extra hard to hold things in place.
That's right.
That happens everywhere, right?
Everywhere in the body. You've got different ways to compensate for old injuries, but at some point things will come to a head and be a problem. It's kind of like if you've ever driven a car where the wheels are not aligned, you can still get from point A to point B, but it's not fun driving that car. You're having to like crank the wheel in one direction, and maybe by the end of it you've got some shoulder issues, but you're able to get there. But if you keep doing that mile after mile after mile and go thousands of miles with it, what's going to end up happening?
You're going to have some wear on those tires.
That's right. You're going to get bald. So you have a choice of replacing the tires but never fixing the alignment, or you actually fix the alignment and then, eventually the tires you're going to have to change anyways.
So what can somebody do with these wrinkles on their joints? Is this just they're going to get wrinkly and just like their face?
So historically, what I would recommend to folks is just exercise. Get strong. Let your muscles take up some of the slack of those ligaments and keep things in check. But with advanced therapies that we're developing here at Wellward, we're able to actually tighten those ligaments up and recreate the stability that that joint should have in its original form. Surgery is another option, but man, that's like cutting the body of a car to get to the wheels to do the alignment. Whereas we can do it with under ultrasound, we can see everything and then inject it with super glue essentially to tighten things back up.
When you say super glue, I'm assuming you don't mean Elmer's.
No, it's you can get it on a grocery store shelf. It's easy to come by. You just kind of stick it into a needle and
just like WD-40 into my joint. All right. I was wondering what we shot in there.
We can use Prolo agents, medications that help stimulate repair in your body. We can use platelet-rich plasma, PRP. These are growth factors or rich growth factors that help stimulate repair response. Even doing a bone marrow aspirate or adipose or fat-related stem cells. These are things that will have a very robust response in the body to tighten structures up. There's a spectrum of options. It just depends on how loose it is and how much Elmer's glue we have left in the clinic.
Okay. And so with some of this Elmer's glue, it not only helps out with some of the wrinkles, but helps out with some of the stuff that you might see with the arthritis though, right?
That's right. Like tendon issues, ligament issues, these will help reduce the wrinkles. And then as time goes on, that joint will start to rebuild its own cartilage and you can actually regrow cartilage on your own. But if it's not going as quickly as it should be, or you want a more robust response, there are also regenerative strategies that will actually help accelerate the growth of cartilage.
Oh, that's great. So that way all these wrinkly joints have a little chance to get a little bit of a nice little boost in youth.
That's right. It's like a facelift for your knee.
Oh, I definitely could use that one. That'd be great.
Well, if you found this to be helpful, feel free to give us comments below and give us direction on what kind of information would be helpful for you. And check us out on our YouTube page, our homepage, wellwardmet.com, or our podcast on iHeartMedia, Spotify, iTunes.
As
yeah,
well.
That's right. So we're in many places. We'd love to hear from you and get feedback on what you would like to hear from us next. But until next time, I'm Dr. Donish.
I'm Dr. Escaloni.
Take care.
See you later.